Welcome to LPN LaunchPad's review of wound classifications. Today's session focuses on how classification systems guide treatment strategies, influence infection control, and affect healing outcomes. Wound classification matters because it helps determine the appropriate treatment approach, predicts healing times, and possible complications, and is essential for thorough nursing assessments and NCLEX knowledge. Several factors influence how a wound is classified, including the cause of the wound, the severity of the injury, the level of contamination, and the overall size of the wound. When considering the cause, surgical wounds occur in a controlled, sterile environment, such as an operating room. In contrast, traumatic wounds result from accidents or violence, leading to a higher risk of contamination. Assess severity by determining whether the wound is superficial, affecting only the epidermis, or deep, involving the dermis, subcutaneous tissue, muscle, or bone. Contamination divides wounds into clean or sterile, e.g., planned incisions, and contaminated, exposed to bacteria, bodily fluids, or environmental pathogens. The size of the wound can indicate differences in healing and infection risk. Minor wounds usually heal faster, with fewer complications. In contrast, more extensive wounds take longer to heal and have an elevated infection risk. Surgical wounds originate in a planned, controlled environment with typically lower infection risks and are often closed using sutures, staples, adhesives, or sterile strips. An incision is a clean cut surgical wound created with a sharp instrument. Procedures such as cesarean sections or appendectomies produce well approximated wounds. Puncture wounds from surgical tubes or ports involve small, stab like openings to insert devices or drains, such as chest tube insertion sites or laparoscopic access points. Abnormal findings in surgical wounds include infection signs like redness and swelling, dehiscence, when wound edges separate, or evisceration, when organs protrude, which are medical emergencies. NCLEX tips for surgical wounds include recognizing that they usually heal by primary intention, carry a lower infection risk than traumatic wounds, and require immediate attention if dehiscence or evisceration occurs. Traumatic wounds result from unplanned, uncontrolled events, such as accidents or violence, have a higher contamination risk, and depend on wound severity for healing. Lacerations are irregular, jagged tears caused by blunt or sharp trauma, and may need sutures or staples. Nurses will see lacerations, most commonly with car accidents or knife injuries. Abrasions are superficial scrapes caused by friction removing the epidermis. They usually have minimal bleeding but a high infection risk, and examples include road rash or scraped knees. Sharp, pointed objects, like nails or needles, can cause puncture wounds. Although they often appear small on the surface, they can be very deep, creating an environment for anaerobic bacteria. Avulsion wounds involve skin or tissue being torn away, leading to significant bleeding and tissue damage, often requiring emergency surgery to reattach or reconstruct the torn tissue. Crush injuries occur when heavy force compresses tissue, potentially causing compartment syndrome. Common crush injuries occur from catching limbs or fingertips machinery, or falls that result in patients laying in the same position for many hours. Abnormal findings for traumatic wounds include excessive bleeding, foreign debris, and delayed healing, all of which call for thorough cleaning and close monitoring. The CDC Surgical Wound Classification System, classes 1 through 4, categorizes wounds by contamination level, with Class 1, clean, having under 5% infection risk, and Class 4, dirty infected, exceeding a 27% risk. Key takeaways for surgical wounds include their cleaner, controlled nature and healing by primary intention. In contrast, traumatic wounds are unplanned, carry higher infection risk, and may require secondary or tertiary healing approaches. Classification factors, such as cause, severity, contamination, and size help guide clinical decisions. And the CDC classes 1 through 4 shape specific infection control strategies. Remember that puncture wounds have an exceptionally high infection risk. NCLEX tips for wound classifications emphasize that surgical wounds generally have a lower risk. Contaminated or large wounds pose more significant challenges to healing. Puncture wounds can harbor anaerobic bacteria. Avulsion or crush injuries involve severe tissue damage. In summary, wound classification addresses whether the wound is surgical or traumatic, the contamination level, and its size, which determine the healing pathway and the necessary infection precautions. NCLEX practice. Question 1. A patient sustains a deep, jagged cut on the forearm with uneven edges and visible debris. What type of wound is this most likely classified as? A. Incision. B. Laceration. C. Abrasion. D. Puncture. The correct answer is B. Laceration because it represents an irregular or jagged tear commonly associated with blunt or sharp trauma, distinguished by uneven edges and often visible debris. NCLEX practice. Question 2. Which CDC class of surgical wound involves direct contamination, e.g., open trauma, or GI spillage, but is not yet infected? A. Class Y, clean. B. Class 2, clean contaminated. C. Class 3, contaminated. D. Class 4, dirty infected. The correct answer is C. Class 3, contaminated, indicates a wound with open exposure to contaminants, whereas Class 4 involves active infection, such as pus or gangrene. NCLEX practice. Question 3. A deep wound from a nail puncture has a small external opening but extends into muscle tissue. How would you best describe its infection risk? A. Low risk because of the small opening. B. Moderate risk if kept covered. C. High risk due to potential anaerobic bacterial growth. D. Minimal risk if there's no visible bleeding. The correct answer is C. High risk due to potential anaerobic bacterial growth, since puncture wounds can harbor bacteria deep within tissue, leading to a higher chance of infection. Thank you for reviewing these wound classifications. If you have any questions, please leave them in the comments. I will reply. Hey there, this is Brian, the creator of LPN LaunchPad. I aim to give every student a fair review for the NCLEX for free, using YouTube videos that can be watched or listened to without losing value. If you find these reviews helpful, help me keep this project alive by hitting the like and subscribe button. Also, check out the free ChatGPT NCLEX review quizzes I have made to accompany these videos. A link is in the description, or search for LPN LaunchPad in the Explore GPT box. This review is an LPN LaunchPad product. We care for our future nurses by freely sharing knowledge.